Good afternoon again. This is Dr. Bill White with the American Orthodontic Society, and I want to go over a case that we have videoed before and many of you have looked at, and there are things in this case that I think are very difficult to really understand how this takes place. But I want to try to cover those this afternoon. I'm going to have to go through the regular part of this real fast, and then at the end of it, or during the time, I'll try to explain these points that I'm talking about. So anyway, let's get underway here. This young lady we saw back in 1987, and I still know where she is, and this is holding up perfectly fine today as it was when it started, except she's had over 30 years. They see that'd be about 13 and 20, 21 years, so it's about, it's well over 30 years that we've been watching this case. So let me go ahead and get going here and show you these things. She's definitely a class 3 malocclusion, and you can see that the teeth are out in front as you show here. The lower teeth are protruding out past quite a bit. Now this thing I want to let's see if this writes. It doesn't. So we're going to have to come back and show you how we brought these teeth back and left the pagodian stayed there. That portion of the jawbone didn't go, but these teeth all came back during this treatment. And a lot of orthodontic cases, the fact probably the majority of them are not just a single jaw thing. They have something to do with the upper jaw. Really, in many of them, the upper jaw needs to be brought forward and the lower jaw brought back to some extent, but it's not all the lower jaw. The tongue probably has a great deal of effect on this, even though you get into genetic problems with some of these cases. Okay, so here we decided she did not want to go through surgery to do this. So we have gone through and done several, a whole bunch of class 3 correction cases where we took out the 6-year molar. Now in this case, this lady had some periodontal problems, and periodontal problems in the family, and she virtually had the gene for the periodontal situation, but she did not smoke. And if she had smoked, I don't think I could have ever done this, move that tooth and bring a periodontally involved tooth all the way up here about part this way and bring this back in here and repair this class 3 problem here. So she did not smoke. We expanded the upper jaw by just using a large arch wire to do that. And on the bottom, of course, we went back with these teeth and made room for these down here. We carried these teeth back, and we had a big space in here, and we didn't use but just a portion of it. Then the other portion of that space, we used class 3 elastics back here, and we pull these teeth back by pulling back on the anterior teeth, pulling these teeth back in here forward, in here to close up the rest of the space. Now here it is. You can see that we got started on this, and we've got a lot of torque in these anterior teeth, and these or right here, and just remember where Pagonian is, right in here. And this was back in 1988. As we bring this back further, now this was when we started. This was 1987 when we started. The lower teeth were out in front of the upper teeth here, and we're going to end up bringing these lower teeth back to a point somewhere around in here, and the Pagonian stays in that position. I thought at the time we would have to do a genioplasty or send her to an oral surgeon to do that, to bring that back, but it didn't. It doesn't show up in the actual pictures of her, and looked just fine, so we never did do that. Okay, here we take out these 6-year molars, and now we're starting to move the second and third molar forward into this space, and we'll bring these teeth back to the spot in here, into a class 1 relation. And then we actually continue to do that. So, in bringing these back, we actually use some class 3 elastics in here and brought the upper teeth in a forward direction, which would give them more room for the upper tongue. We think that the tongue had some effect on this in spreading the lower teeth out further than the upper teeth, and so we think the tongue had some effect on this. So here we are in 1988, and we start in, and it looks like we lose a lot of bone structure on the teeth, and we slowed down on it. This tooth looks real bad here, but it will look better as we slow the treatment down. So here we pull this into a class 1 relation, pulling these teeth back in and pulling this forward. Let's see, I think I didn't erase. So here we go back with this. As we got further back, we had several other examples in here. This tooth was rotated about 90 degrees. So when you turn it, you're going to get a reduction of the tissue there. It'll strip through the bone, and you do it almost invariably unless you put the bracket on the outer edge, which is very hard to do, and do any kind of torquing with it to get it back underneath there. So we went ahead and treated it that way, and then torqued the root in when we got it back, but we've got a kind of a pocket on that tooth that we'll have to deal with there. So here we continue to go, and we're expanding and bringing that together. We'll enlarge the upper arch with just a larger, kind of a Big Daddy wire, and this is that's 87. We're carrying it on back. Now here we're pulling these teeth back here by pulling these teeth forward in here, and some of it you come into it. You get this to class 1, you stop, and then bring this to class 1 too, and then you be together back at the back. And don't wait a month or 2 or any more than you have to. I mean, extract these teeth, and if you can, the very day, start moving these teeth forward into it and moving these teeth back, and you can put teeth together like that on an adult in a lot less time. But if you leave it alone, this knife edge will form right in the middle, and then it takes a lot longer to bring the teeth together back here. Here we've got this elastic wrapped around this tooth, and you start out, you hook the elastic here, go around the tooth, and then hook it over here, and it turns it in this direction, and that brings that tooth around and settles it, but anyway, it cuts through the bone structure as it moves. The root's flat. Now here is a bad picture. Because in '87 we used a large arch wire here to expand the upper arch as we brought it forward over the lower arch. We expanded it there, like that. And that's the upper Big Daddy stuck in the headgear tubes, and we just expanded that upper arch with that. Now if you expand it very much, and we may have put some torque, but I don't see it in that arch wire there, you bring it out, then your lingual cusps tend to touch more if you don't get enough buccal root torque when you bring this out. So we brought it out and got our buccal root torque in here. Now on the lower, we're closing the space up, and we have rotated this tooth. Now as soon as we can, we're going to get into we got to rotate another one. We'll get into a rectangular wire and torque the root of that tooth in. All right, we're going now to another, and you see after we get this lined up and the lowers underneath and the root of this tooth exposed. So we're going to torque this. We're going to bring this one in, and you'll notice this tissue will kind of fill back up, but you still got a pocket on that tooth. And it's hard to do that without losing some bone structure on that particular tooth. Now, here you can see the root of that tooth, and we're going to bring this root in to the tissue, and the tissue will gradually fill it up. That's 1988, and we slowed down on our treatment. Now, here the same thing is going in place, and we've widened the upper arch now, and we've got buccal root torque. Apparently these teeth are pretty leveled out with the rest of the teeth as we go now. All right, at this point we've got into, I think it's a rectangular wire. We'll put torque in this tooth right here and bring it in, and it'll kind of pull the others forward as it does, but you cover this up and you watch this tooth, this gradually tissue will close in over that root. Now we're put the omegas in here, and we're pulling this in this direction like this, pulling this together. And as we get to class 1, now let's see, we working toward class 1 here. We've used up about half the space, but she's got a good facial profile now. She put on a few pounds of weight, and it shows on her. Let me go back here and take that away. But then she loses it again. And now at this point, we put we've got the teeth pushed over there, and we wanted to bring the upper teeth forward some. So we hook up class 3 elastics to this, and we'll pull this forward, but we run interference by running this lip bumper over these roots and having a space between there about 1.5 millimeters or 2 millimeters, and you have a vascular bed there that allows the bone structure and everything to develop underneath that and bring it in. If you push the teeth into some tight lip structure, especially structure on the lower lip down here, you got to use lip bumpers to kind of run interference form so the vascular bed can go in front of the developing bone as you go out. Now on the cheek side, you don't have to worry about that. It's worse down here, but some problem up here, so we're using a lip bumper that'll bring that. Now see, this tissue has risen up almost to these other teeth right in here. So it'll continue to, it kind of comes up even further than that. All right, this is 1988. We pulled that back under. We're using this lip bumper. You see we have expanded it out, and keep running this out as we bring these teeth further forward. So we're getting a double jaw treatment here. We're bringing the upper anterior teeth forward as well as bringing the lower anterior teeth back at the same time. And we took out these 6-year molars, and it gave us a lot of space to work with in there. And so we'll bring it back under so that the tongue can have a greater space in the upper arch and maybe keep this from relapsing as we go along. And it did just that, because we've watched it for 30 years now, and they have not relapsed. This is not relapsed there. So we've got both arches. We widened it out and gave a little more room for the tongue to occupy that space. And now the bottom is together and everything's together. This is 1989, and we started, I think it was 87, and we're on down the line. We still got some spacing in here, so we're going to pull a little bit more and try to get as much space up there for the tongue as we possibly can. So here it is, and this is 2000. Oh, that's not the number there. Anyway, we're just about to finish the case out. We got the midline lined up. Now we've gone to this point, and we come in and put a retainer in there. We put some little acrylic pads right here. If you see, that's acrylic pad, and right in that area and right in this area over the cuspid. So when you snap, this wire goes up underneath that pad and stays right at that level all the time. And we have to wear that religiously, just stay there. Our midline is off a little bit, but not much. And now we're about ready to take it out and see what happens in here. We slowed down because of the periodontal work for a while. Now there, you can pick up this acrylic, a good acrylic, and it'll put your line right where you want it. If you want to make sure this stays up, you can put some acrylic underneath these, and you kind of bring it over this one and under that one, and this thing will stay in there, and you'll have trouble pulling it out. If you want to put class 3 retention on them, sometimes we do that and bring it around. We put this acrylic underneath these molar teeth like that and put a hook back here, and we hook elastics to the front and keep pulling this upper arch forward in there, but didn't have to do that in her case. All right, the other side's very similar. And now this is 1991, and we're in the retainer, and we put a bite plate right in here where she bites, and the lower teeth come up and touch that spot right there. That keeps the overbite, overjet, and overbite the same thing as you finish out the case, like that. So we'll now the points that we wanted to bring out is that where a tooth is almost 90 degrees rotated in the lower anterior, the flat part of the root's sitting kind of like that, and the flat part's here, and you turn it around, put the flat part of the tooth out here, and now the skinny part of the root's going to be facing forward, and that's hard to keep it from cutting through the tissue, and also having the bone, the tooth root just go slightly through the bone, and you can torque it back in when you want to, and tissue will fill over it, but you still got a slight pocket back in that area there where you finish it back. All right, let's go on to, and now this is 1991, and this is where I think we've taken her out of all of this. Yes, this is 91, and we went from that point to this point right here. And that's 3 years. Well, we did 87 to 90, and we finished this a little earlier. You can see this acrylic where we watched the put the upper retainer stops at that point to keep that line at that point. That's where the wire will stay going back in there, and maybe have something going back in that fashion. And we built our lower retainer, wraparound retainer. I have nothing going over the occlusion. I do not want to have wire coming over the edges. You bite it regardless, almost. All right, here it is in 1987. There it is in 91, like that. 87, 91. And we use it. And this is, we put an 040 march in it there, and you see how large we expanded it. That's the picture's bigger anyway, but you look here where it has actually expanded the upper arch, and we didn't use any. I think we probably did use some buccal root torque on the molars or bicuspids, and that's the lower arch, and that's where this tooth really gave us a problem there and expanded, and now we've brought that around. Let's see, I think we had some. All right, that was 91 or something. You can see how there's a few years passed between that and this. Let's see, this is 87. And I don't see the date on this right here, but it seems like it's about 20 years take place in there, and those teeth are still lined up. The profile is right on the money, and these are pictures that have been taken. She's not scaling that good. There is the tooth that lost the tissue. It stayed good. If she keep this scale real good, she could do that herself. And it looks like that. And that's several years. That's 2010. We got her back 2010. The upper's lined up good. That's the upper arch, and she's still wearing a retainer, if I remember correctly. And that's kind of ground into a class 1 relation, and you would never know that this is a second molar, this is a third molar, and she kept this one. It touches a little back in there, and that's held up that long a time. 2010 from 1987 is about like 23 years, and then this 2020 something so we've been in there over 30 years, and this is still holding up. Now here is one thing I wanted to bring out. If you remember the Pagonian is sitting out here, and the teeth were out here first. Now we've moved these teeth back, root, everything back that far, and left the begonian out there, but it doesn't look bad on her, and we just left her alone. If it had really poked out and looked bad, we would have probably sent her in for an oral surgeon to do that. And that's the third molars are hanging off the edge, and they're kind of chewing into the tissue back here, and she has not taken them out. Now that's January the 7th, that's 2010. We took some pictures of her then. And it's 2010 again. Everything's lined up. Now I think that's 2010. We've got a little space opened up right in here. Not much, but 2010. And there it is at this point. She's aged 25 in 6 months. At this point right here, this is when we were working on her. Now, here it is after the 1987, and you see the begonian is sticking away out here, and you watch that we're going to bring these teeth back to about here somewhere, and this begonia will stay the same length right there. And watch that go now as we move this back. Whoop. Sorry. I'm going to say we're going to keep these. Okay. That's 1987. There's where we started with. Anyway, the begonias stayed pretty much the same. We brought it underneath there further. I'm sorry for this. Okay, so when you're doing class 3 cases, we use a lip bump up here and developed and brought this forward, and we widened that upper arch to give the tongue more space up above, and this has stayed about 30 some odd years now without any problems. So I'm going to say goodbye. I hope you get something out of this, and I feel like this removing of lower 6-year molars is an excellent way to have a non-surgical class 3 correction in here, and that's to me a real advantage. And there are many cases that can be done by simply removing the lower 6-year molars. So I'll say goodbye and hope you get something out of this, and I'm going to hush up now and we'll close this up. Thank you.